countries where EMS systems are well developed or still developing in other countries is that patient education. Patient education is quite important because the general public, they don't know the emergency numbers. They don't know what we do. And probably when we started the conversation that we had on the podcast is that people think that we are just a ambulance drivers, but things are changing. So that patient education needs to be there to let people know that we're not just ambulance drivers. We can actually perform life-saving treatments or interventions to make sure that people's lives get saved, or they know what we can provide. And I think if I think about it, you always see ads about tobacco or alcohol or about nice lifetimes, but conversations that we're having now are not being advertised, are not being out there in the general public. I know this podcast, we're probably going to be pushing it on TikTok, and we hope that it will reach a wider audience in Kenya so that they can be well aware of what is happening in the EMS systems. And I've realized that TikTok, as much as I don't like social media, TikTok is one of the most platforms that people use for information. Amazing enough. And I hope it will reach the people in Kenya so that they can be well aware of what's happening in the emergency side of Kenya. Yeah. Sorry, Elias.
I know it's
Just on that,
right.
maybe just commenting on that. I mean, the social media is big here, but people use social media. When we started the organization, that's an interesting part of it. The first thing we did was build all our social media platforms to provide medical emergency care information. The consumption was quite good. In fact, the demand from our Facebook, Twitter not much. That time it was Facebook. We're a bit old.
Yeah.
People were consuming this information. I think it's just that our communication, and it's a challenge for us, even as an organization, to build on our communication to the public to enhance access and understanding of emergency healthcare services. It's one of the things that's on our strategic plan into the next 3 years.